Let's start.
Okay, sir.
Okay, in anesthesia we use muscle relaxant. After anesthesia we use surgery. Yeah, the patient undergoes surgery. In surgery we need muscle relaxation. Why we need muscle relaxation? For example, if you cut the skin, you again stitch the skin with thread. Yeah. So if muscle again contract with the pain stimulus, then the stitch is not able to hold the skin approximately. So it's very hard for wound healing. Understand? Okay, after surgery, when surgery is done, we also need to use antibiotics. Why we need to use antibiotic? Of course, we need to use antibiotic to prevent infection because the skin is wounded here. Skin now have wound the surgical wound to prevent infection. So we need to use antibiotic. So antibiotic, if in the patient after surgery we use antibiotic, if we use aminoglycoside, aminoglyco aminoglycoside. It's a one group of antibiotic, okay? Aminoglycosides. In aminoglycoside, we have in gentamicin, gentamicin. Later, I will teach in antibiotic group, okay? Amikacin, amikacin. So these antibiotics we use after surgery. Understand? If we use this antibiotic in surgery, after surgery to prevent the infection, this antibiotic, aminoglycoside, this antibiotic also interact with neuromuscular junction. This antibiotic also interact with the muscle, with the nerve. This antibiotic doing what? This antibiotic block the release of acetylcholine. Understand? Block the release of acetylcholine. You already use to relax the muscle in the anesthesia stage, okay, before surgery. So you're already using what? Curare. Yeah. So now you're using Curare in the same patient. You're also using which drug? Aminoglycosides. That aminoglycoside antibiotic to prevent the infection after surgery. So this drug doing what? Block the release of acetylcholine. Can patient recover very rapidly? You also have Curare. Yeah. This Curare family doing what? Relax the muscle. Yeah. Your muscle paralyzed. The surgery done, the anesthesia done, surgery done. Now person the must wake up. The person must able to use his or her own muscle. Yeah. Able to move limbs. So if you're using these antibiotics, you must reduce the dose of Curare. Must reduce the dose of Curare. Understand? If you want to use aminoglycoside as an antibiotic after the surgery to control the infection, done. Aminoglycoside can lead to muscle relaxation, very strong muscle relaxation there, muscle paralysis for more longer duration. Okay, aminoglycoside also block acetylcholine. Understand? This receptor is already blocked by Curare family. So if you decrease the acetylcholine, then what happens? Then Curare family, this drug, Curare drug, can block the muscle for more longer time. Clear? Surgery done, 6, 7, 8 are done. Patient still not able to move his limbs or arms, not able to use muscle. Clear or not? Okay. So if we want to use a aminoglycoside antibiotic, the same patient also having the using Curare family in the same patient, then we must reduce the dose of Curare. It's an interaction. Write a question here. What interaction between Curare and aminoglycosides? What interaction? Aminoglycosides increase the effect of Curare. Understand? Curare doing what? Muscle relaxation. Muscle relaxation. For example, if we use just Curare family, the Curare doing muscle relaxation for 6 hours. If you also add aminoglycoside using antibiotic, this muscle relaxation, muscle paralysis may for 10 hours, may for 12 hours, more longer duration. So you must reduce the dose of Curare if you want to use the aminoglycoside antibiotic. Understand? This interaction clear? Otherwise, maybe it's not good for patient. More muscle can paralyze for more longer duration. If diaphragm, if diaphragm paralyzed, oh, it's now will be difficulty in breathing. Yeah, clear or not? Another question: how you can reverse? How you can reverse overdose, overdose of Curare? If by mistaken you give injection of Curare to the patient or a very high dose, clear? Very high dose, or it can paralyze all body muscle. Yeah, it can paralyze diaphragm. If you paralyze diaphragm, you able to breathe? Of course not. If using very high dose, how you can reverse it? You must increase acetylcholine. Understand? Because there will be competition between Curare and acetylcholine. If you increase acetylcholine, then who will win? It depends upon concentration. If acetylcholine high in number, then acetylcholine attach with receptor. Yeah. If Curare number, this drug number high, then Curare will attach. So how you can reverse? Increase acetylcholine. The answer: increase acetylcholine. Understand? Increase acetylcholine. So acetylcholine increases. How you can increase acetylcholine? Using what? This is done in last chapter. Acetylcholine esterase inhibitor. Yeah, acetylcholine esterase inhibitor. Which drug? Pyridostigmine. You know, pyridostigmine, physostigmine. So you must use acetylcholine esterase inhibitor in case if the patient receive overdose of Curare. Understand? If patient receive overdose of Curare, to reverse, how you can reverse it? Because there is a competition between Curare drugs and acetylcholine to attach with acetylcholine receptor. Done? It's all about neuromuscular junction blocker, Curare family. Tubocurarium, mivacurarium, rivacurarium, pancurarium. Okay? Another vancuronium, 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 pancuronium, riva, mipa, tubo. If you can memorize one, two, or enough. Atracurarium. To memorize all, you need more time. Repeat pharmacology again and again. Atracurarium, mivacurarium, tubocurarium, pancuronium, vancuronium. These all drugs belong to same family, the Curare family. The Curare family, the group name non-depolarizing neuromuscular junction blocker. Okay. So what the use of these drugs? We use for muscle relaxation, as a muscle relaxation. Yeah. So in surgery, we need muscle relaxation. Before surgery, we gave Curare family drug also in anesthesia. Yeah, atropine also part of anesthesia. Curare family, these muscle relaxant also part of anesthesia. So what is the interaction between aminoglycosides and Curare family? The aminoglycoside, these antibiotics can increase the effect of curare. So you must reduce the dose of curare. Understand? Must reduce the dose of curare family to achieve normal effect. If the curare effect is very high, then it can paralyze diaphragm. If diaphragm paralyzed, then game over. Understand? So in case of overdose, how you can control by mistaken 2-time injection there curare, and how you can reverse? You must increase the acetylcholine. Must increase the acetylcholine. This acetylcholine can reverse. Understand? Acetylcholine can reverse the action of curare family. Physostigmine, these drugs can increase acetylcholine. Done? If too much action of curare is there, very high dose can paralyze all body muscle, can paralyze diaphragm. Diaphragm paralyzed at last. The curare family first paralyze limb muscle, then paralyze face muscle, then at last paralyze diaphragm. So if diaphragm paralyzed, then the breathing difficulty, the patient can die. Okay. So in case of overdose, you can reverse the action of curare by using physostigmine, pyridostigmine. They can reverse the action. They can increase acetylcholine. Then acetylcholine compete with curare. Understand? To attach the receptor. Then the muscle contraction again come back. It's all about cholinergic antagonist. Third group was ganglionic blocker. Very rare use, mekylamine. Mekylamine, ganglionic blocker for NN. This only used in one use in smoker. If they want to quit smoking, acetylcholine. So in smoker, to control the withdrawal effect, we use mekylamine. It's a ganglionic blocker. The mekylamine, because mekylamine ganglion present in both parasympathetic system, also in sympathetic system. So NN receptor present in both. Okay, it can also increase or decrease sympathetic or parasympathetic both system. So that's why this drug is not much effective, because this drug interfere with both system. Okay, so this drug is not very much useful in clinic. Only one use mekylamine in smoker who want to quit smoking. Mekylamine. In smoke we have nicotine. Yeah, in smoke we have nicotine. Nicotine is the alternative for acetylcholine. Nicotine is the alternative for acetylcholine. Okay, the ganglionic blocker. It's all about cholinergic system. It's all about cholinergic system. Any problem till now?
No, sir.
Cholinergic system done.
Yes.
Agonist and antagonist. These drugs also help you in respiratory system, also help you in CVS system. We again repeat these drugs again and again. That's the autonomic nervous system pharmacology is very important. Okay, now we move on. Next system, adrenergic. Adrenergic. This system, sympathetic system. Okay. In this system, we use norepinephrine, epinephrine, dopamine. Dopamine is also neurotransmitter of sympathetic system. Okay. So receptor alpha, beta, and dopamine. So receptor alpha, beta, and dopamine. Norepinephrine prefers alpha. Keep in mind. Epinephrine prefers beta. Okay. Epinephrine prefers beta receptor. Dopamine part. Dopamine receptor. All these drugs, epinephrine attached with, also attached with beta, also attached with dopamine. Epinephrine also attached with alpha, also attached with dopamine receptor. Okay. Dopamine also have ability to attach with dopamine receptor, alpha receptor, and like this. You can see the preference. Norepinephrine first prefer alpha. Epinephrine prefer beta. Dopamine prefer its own receptor, dopamine. Understand? So these neurotransmitter can prefer any receptor, can attach with any receptor, but the preference is matter. The problem is preference. So why we select norepinephrine? Why we not use it for asthma epinephrine like this? Why we not prefer norepinephrine for asthma patient? Okay, like this. So must be the preference, some preference here. If you understand the neurotransmission of sympathetic system, you can 50% understand CNS pharmacology. I put more stress on the production. How you able to produce epinephrine and norepinephrine? How we produce? Okay. There are a lot of drugs we use in CNS system acting on this neurotransmitter. Many drugs, many drugs. 50% CNS pharmacology cover from this sympathetic system pharmacology. Must keep in mind. Okay. The first step, acetylcholine, how we produce acetylcholine esterase is everything you know. Yeah. Now move on. How we able to produce norepinephrine? First thing we need tyrosine. We need this amino acid, tyrosine. This tyrosine enter inside the neuron, okay, and tyrosine change to tyrosine, the hydroxylation of tyrosine there, okay, hydroxylation of tyrosine change to L-dopa, L, L-dopa. This L-dopa change to dopamine, then this dopamine change to norepinephrine, then this norepinephrine change to epinephrine. How many steps there? So L-dopa, 1, 2, 3, 4. There are 4 steps, okay? 2 steps, OH group attachment, 1 step, CO2 removal, 1 step, CH3 addition, CH3 addition, methylation, 1 step, methylation, 1 step, removal, decarboxylation, another step, 2 step, these are 2 in number, okay? 2 step, hydroxylation, 2 step, hydroxylation. Hydroxylation means you need enzyme here, hydroxylase. Here you need enzyme here, decarboxylase. Here you need enzyme here, methylase. Understand? 4 steps. This tyrosine change to epinephrine. Clear? Tyrosine change to epinephrine. So L-dopa, the first step, hydroxylation. Okay. First step, hydroxylation. Second step, decarboxylation. It's the removal of CO2. It's the addition. Okay. Third step, again addition of OH. Another hydroxylation. Last step, addition of CH. Understand? Fourth step, tyrosine change to L-dopa. How? Add what? OH. L-dopa change to dopamine. How? Remove CO2. Understand? Dopamine change to norepinephrine. Okay. How? Add what? OH. Clear? Next. Epinephrine change, norepinephrine change to epinephrine. How? Add what? CH3. Clear? So we're having four enzymes. So if you're having four enzymes, you can imagine how much long pharmacology. In some parasympathetic system, you just use one enzyme for production, acetylcholine transfer, and one enzyme for breakdown. Okay, one enzyme for breakdown is the acetylcholine acid. Here, four enzymes. Understand? Okay, write a sentence here. This tyrosine changed to norepinephrine is a nerve only having three enzymes. Now you tell me, can nerve able to sympathetic nervous system, yeah, neurons, can produce epinephrine? Not. Sympathetic system neurons not able to produce epinephrine. They only producing norepinephrine. Okay. Epinephrine, how? Second thing is four enzymes present in adrenal medulla. Adrenal medulla. Only adrenal medulla cell, medulla, adrenal gland, medulla producing epinephrine and norepinephrine. Yeah. So adrenal medulla produce epinephrine. Adrenal medulla produce dopamine. Adrenal medulla produce norepinephrine. Everything because having all four enzymes. Understand? Adrenal medulla cells, they can convert tyrosine to epinephrine because having. So adrenal medulla release what? Sometime MCQ. Adrenal medulla release epinephrine more or norepinephrine more? Epinephrine. Adrenal medulla producing lot of epinephrine. And sympathetic system neurons producing only norepinephrine. Yeah? Understand? Why? Because three step here. 1, 2, 3. Okay. In nerves only three enzymes there. In sympathetic nerves we only having three enzymes. Done. But in adrenal medulla we having four enzymes. Clear or not? So adrenal medulla can produce epinephrine. And nerves only producing norepinephrine. Clear? Okay. Another thing. If you have methyl, if you want to attach with beta receptor, you must have methyl. If you want to attach with beta receptor, you must have methyl group. So that's why epinephrine first preference beta receptor. Clear? Norepinephrine. If you're not having methyl group, your affinity for alpha receptor more. This concept clear? Why norepinephrine prefer alpha? Why epinephrine prefer beta? Epinephrine having methyl group. So just because of this extra methylation, epinephrine attach with beta first. Okay? And norepinephrine attach with alpha first. This is a difference. So how about the dopamine? Dopamine having one OH group and then you remove CO2. Dopamine first attached with dopamine receptor. Understand? Dopamine attached with first dopamine receptor because dopamine only having one OH and removal of CO2. Norepinephrine having two OH. One OH here, one OH here. Yeah? Clear? Norepinephrine not having methyl group. This difference clear or not? Why norepinephrine prefer alpha, prefer beta? Norepinephrine prefer alpha and epinephrine prefer beta. Clear? This concept clear or not? This preference. Everyone done till here? The tyrosine change to L-dopa, then dopamine. This dopamine, right? Another thing here. This dopamine, L-dopa enter to vesicle. Okay. L-dopa enter to vesicle. Okay. The first, this OH, How you add OH? We have two hydroxylase. How many hydroxylase? Two hydroxylase. Number one, first hydroxylation, tyrosine hydroxylase. Which hydroxylase? Tyrosine hydroxylase. Understand? Tyrosine hydroxylase. This hydroxylase present in cytoplasm. This hydroxylase present in cytoplasm. Okay. Another hydroxylase. Dopamine hydroxylase. Which hydroxylase? Dopamine hydroxylase. This dopamine hydroxylase present where? You can see where is your dopamine? Inside vesicle, yeah. So this hydroxylase, another name, vesicular hydroxylase. How you produce norepinephrine? Norepinephrine already inside vesicle, okay? Norepinephrine produced inside vesicle, not in cytoplasm. Clear or not? This tyrosine outside, yeah. Then you change to it L-dopa. L-dopa change to dopamine. This dopamine inside the vesicle, understand? Okay. So inside the vesicle, you add what? Another OH. Then it change to norepinephrine. So change. So that is the hydroxylase name, vesicular hydroxylase. Sometimes the examiner asks this question. One hydroxylase in cytoplasm, one hydroxylase in vesicle. One hydroxylase in cytoplasm, one hydroxylase in vesicle. Is clear? Okay, last thing, then we finish class. How many enzymes we use till now? 4 enzymes. 1, 2 hydroxylase, tyrosine hydroxylase, vesicular hydroxylase 2. Okay. Then decarboxylase. Another methylase. Understand? Methylase, decarboxylase, 2 hydroxylase. Okay. When epinephrine come here, for breakdown, we have 2 enzymes. Number 1, in synapse, COMT. In synapse, we having COMT. Inside the nerve, what is this? It's a mitochondria. Inside the nerve terminal, we having mitochondria. In mitochondria, MAO, monoamine oxidase. MAO, monoamine oxidase, MAO. These 2 enzymes for breakdown, okay? In acetylcholine, just 1 enzyme for here we have 2 enzymes. Now you can imagine 6 enzymes we use, 4 for production, 2 for breakdown. You can imagine how many drugs can we use here. Enzyme, the drug block MAO, drug block COMT, drug block decarboxylase, drug blocking hydroxylase. Clear? Too many steps there. So the CNS pharmacology 50% is come from this. Okay, it's very, very important. Sign up for this class. Tomorrow we will continue from this. Okay.
Yes,
If you have
sir.
any questions, you can post in group.
Okay, sir.
See you tomorrow, inshallah.
See you tomorrow, sir.
Thank you,
Assalamu
sir.
alaikum. Allah Hafiz.
Waalaikumsalam.
Thank you, sir.
Thank you, sir.
Welcome.
Thank you, sir.
Thank you, sir.
Habib, now you can sleep very well while lecture you.